Trauma surgeons and staff at Harborview Medical Center in Seattle have been treating patients with gunshot wounds for decades. It's always difficult.
If that person is reminds you of your own kid, makes a big difference. Shouldn't, but it does. As a human being, you see it.
But in recent years, the number of gunshot victims admitted to Harborview has increased dramatically.
We used to, on average, before the pandemic, take care of about 300 or so patients with gunshot wounds a year. Now we're in the 500 range.
This sharp rise in gun violence in Seattle and Washington state mirrors the rest of the country.
Gun violence is surging across the U.S.
Gun violence in America is a public health crisis.
And now, many medical professionals whose job is to respond to all of this violence are trying to prevent it from happening in the first place.
We really do need to take a step back and think about trauma and injury, and especially violent injury, much more holistically, because there's so much that's happening in an individual's life that contributed to that injury.
This is Northwest Reports. Stay tuned for a 3-part series about the impact of gun violence on healthcare workers in our region and the program that's been launched at Harborview to intervene.
Me being able to build that relationship, it kind of puts a lot of patients at ease of you know what, somebody does care.
Listen here every Wednesday starting September 25th.